So I've been tasked with talking about Fabry and the brain. So I guess I'm going to talk about a few bits and pieces. So as an overview, I'm going to look at, first talk about what we can see in the brain when we take imaging studies. So if we use MRI scans, what do we actually see that's different in patients with Fabry versus patients who don't have, people who don't have Fabry? I'm going to talk about stroke because it is an important consideration. And I'm also going to talk a little bit about neurocognitive outcomes. It's a bit low, isn't it? Oh, hang on, maybe I should do that.
You must be taller than me, Mike.
Yeah. Okay, how's that? Is that any better? Right. No, not really. Okay. Yeah. No, I think I may have broken it. All right, shall I talk loudly? Is that better? Yeah? All right, so structural changes first. So MRI scans allow us to look inside people's heads non-invasively, which is a very good thing. So there's sort of, in the literature there's I guess three different bits to what we can see when we do MRI scans. And the first one I'm going to talk about is a thing called the pulvinar sign, and this was described a few years ago as being what we call pathognomonic, or sort of, maybe I should just use that one, in a sense diagnostic of Fabry disease. Here we go. How's that? Better? Excellent. All right. Okay. That's better for me too. All right. So, yeah, so what, I don't have a pointer, but I'm going to run over here and point. But when we look at people's brains, there's sort of these two lighter patches here, you can see there. That was described as, they're not generally seen in MRI scans, and so this was highlighted as an unusual thing that was perhaps diagnostic of people with Fabry disease, and I think that's been propagated through the literature for a while, but I think we now recognise that maybe it's not quite diagnostic of people with Fabry, and actually maybe only about a quarter of people with Fabry disease actually have this sign on MRI scan. But I do mention it because it does come up in the literature a little bit. But the other two images there, B and C, I'm going to talk about in a little bit more detail. They're certainly important parts of Fabry in the brain. So the first one is the middle image there, image B, is an image of the blood vessels that run through the brain. And what we've noticed after scanning quite a lot of people with Fabry is that the blood vessels are longer and a bit more twisty, or what we call tortuous, and also dilated or larger in people with Fabry disease. And I'll talk a little bit about why that might be and whether that's important or not. And then the third type of structural MRI changes we see here are related to blood flow in the brain. If blood flow stops in the brain, then the delivery of oxygen to the brain stops, and of course that's a problem. But the sort of things we can see from altered blood flow in the brain are, firstly, we can see changes from stroke, and that's this big change over here. And that's where that little part of the brain has died. But we can also see little changes of what we call white matter lesions, which are little white spots in the brain here and here. They don't immediately necessarily make any clinical difference to a person, but we can certainly see those white spots on brain scans. So we're going to talk about the blood vessels. So blood vessels are larger and they're twisted in people who have Fabry disease. It's a little bit hard to see, but the twisty images over here, normally what we would see in a person who didn't have Fabry is fairly straight lines down here and down here. But as you can see highlighted there, those blood vessels are relatively twisty or tortuous, and you can see this blood vessel here is quite a lot bigger. This is the basilar artery, and normally it would be perhaps that big, but you can see that it's quite enlarged. That little graph down on your left is some data from our own group here, and what we've been able to show is that the size of that basilar artery when we do the MRI scans actually does correlate with disease severity. So there's a score called an MSSI score, which looks at things like is the heart involved, are the kidneys involved, what is the disease severity in a particular person, and we can see that it correlates with the diameter of the basilar artery. What's also interesting is that the diameter of the basilar arteries also seems to be responding to enzyme replacement therapy. So for people who've been on enzyme replacement therapy for longer, then their blood vessels are perhaps less affected. So that's an encouraging bit of data that's just been published fairly recently. What about white matter changes? So I'll sort of talk through this image here a little bit, but so this is a scan of someone's brain as though we've sort of taken a slice horizontally through their eyes or a little bit above. And what we normally expect to see is this is brain all around here. This is the fluid inside the brain here. And what we don't expect to see is this white stuff here. So that's what we call the white matter lesions or the white matter changes. And for people who have Fabry, we commonly do find white matter changes. Now, they're not always associated with any clinical signs at all, but if we compare a control population to a population with Fabry disease, there's certainly a lot more white matter lesions. And the little box down the bottom left there is sort of the data from our group where we scanned a number of people with Fabry, and we're able to show that the amount of white matter changes that we see in them is significantly greater than the control population. So if we look beyond just our little study, but if we look into registry studies and registry data, what we can see there, you can see that white matter lesions, WMLs, are actually really common in people with Fabry. So as I mentioned, they're there, but they don't necessarily cause any clinical concerns. But we think they're an indicator, perhaps, of disease severity and things happening. We know that they're present in maybe about half of the people who have a diagnosis of Fabry, and they increase with age. They did seem to be found in both men and women at equal prevalence or equal rates, but in the group that was studied, the women in the group were studied at a later age. So it's likely that white matter lesions in men progress or appear at a younger age and perhaps progress more quickly. And I guess just heading down the dot points there, we do know that they do progress over time. And the initial bits of data suggested that enzyme replacement didn't seem to affect progression in the registry, but there's some other data that suggests maybe it does make a difference. So I think the jury's perhaps still out on that. The other white matter changes that we see are what we call lacuna infarcts. So it's a technical term, but what it basically means is tiny little spots where the brain, where the blood flow to the brain has been interrupted, and that small piece of brain has died. But clinically, lacuna infarcts don't seem to cause any particular problems generally, but we do see them in Fabry more often than in controls. And just on the imaging scans, what I'm talking about here are these little black dots here. So we see lacuna infarcts in people who have Fabry more commonly than we do in controls as well. And this probably relates back to those little blood vessels getting filled up with gunk, as Dawn mentioned, and blocking off and stopping the blood flow to that little part of the brain there. So they're the sort of structural things that we can see when we take MRI scans. We can certainly see changes and differences. So moving on to the effect of stroke in Fabry disease. One thing, I'll quickly describe what a stroke is for the audience though. So stroke is essentially a sudden interruption in the blood supply to a particular part of the brain. Now there's two different types of stroke, and they might seem a little bit counterintuitive, but there's what we call an ischemic stroke, where the blood flow is, the blood vessel is blocked. So if you imagine all of the brain supplied by the blood vessels, little tubes, and if you block off one of those tubes, then the blood can't get to that particular part of the brain that requires the blood flow and thus the oxygen. So an ischemic stroke is where you get a blockage of the pipe, so to speak, the blood vessel. A hemorrhagic stroke is where the blood vessel breaks or bursts. So although there's lots of blood in that part of the brain, it's not actually flowing, so there's not new oxygen coming through to that part of the brain. So they're the two major types of stroke. There's blockage and bleeding. What happens if the blood flow is interrupted to a part of the brain? Well, then symptoms develop. So there's loss of neurological function, and it depends which part of the brain is affected by the lack of blood flow. So things like weakness, balance problems, vision problems, speech difficulties, either understanding or being able to speak, or changes in the way we were able to feel things, so sensation, are the sort of symptoms that can come on with a sudden interruption in the blood supply. When we talk about stroke, we also talk about, I guess, timing of the symptoms as well. What we call transient or transient ischemic attacks are strokes that just last briefly, perhaps a few minutes, perhaps tens of minutes, but a stroke is something that's longer lasting and the damage is more permanent. And so it's a more important thing to happen. So, what about stroke in people with Fabry? I know stroke is talked about as one of the major manifestations of Fabry disease, but I think it's important to recognise that it's still actually relatively rare in people who have Fabry. So you can see the numbers there. Actually, out of a large registry cohort of 1,200 patients with Fabry, only 7% of the men had experienced stroke, and about 4% of the women had experienced some form of stroke. So, although it is talked about as an important thing, I think it's important not to make too much of it, or to make it a frightening thing, even though it is important. One thing about stroke in Fabry though is if it is going to happen, it does tend to occur at a younger age than in the general population. So you can see here the median age at first stroke was 39 years in men and 45 years in women. And quite strikingly, for people who have experienced a stroke, often that event occurred before they were even diagnosed with Fabry. So we all know that Fabry is a rare disease and difficult to diagnose, and often people go through a long diagnostic odyssey to get to the point where their Fabry disease is diagnosed. And for them, a proportion will have had their stroke before being diagnosed with Fabry. If we look at the actual risk of someone having a stroke compared to people in the general population, this is what this graph shows. This is reasonably old data now, but it's I think it still holds. Each time point here is 10 years of life, so I'm making sure I'm not getting in the way. And the white dots here are men and women in the general population and showing their risk of stroke. And you can see here it does go up as we get older. But what we can see with the Fabry population is that, especially once we start to get out beyond 35 years of age, the black square and circle are the Fabry patients, and that risk of stroke does increase above and beyond the general population, perhaps broadly kind of twofold or thereabouts. So there is an increased risk of stroke in the Fabry population, and particularly as time goes on. Another way of looking at the question of stroke is to think, well, actually, if we look at the general population of people with stroke, because it is a very common medical disorder, how many of the people that have had a stroke actually have Fabry? There's been quite a lot of studies looking into that. And if we only look at young people with stroke, if we look at older persons with stroke, then the proportion of people with Fabry is absolutely tiny. But if we look at people who are young who've had a stroke, then actually there is a small but significant proportion of people who will have a diagnosis of Fabry disease. So it is an important cohort that people have looked into to try and find diagnoses. So why do people who have a diagnosis of Fabry have stroke? We don't completely understand it, I don't think. We're really learning more and more about that and starting to understand. We know that there's changes in the way the blood flows through the brain, and we've seen that just with the imaging studies showing that the blood vessels are more tortuous, they're bigger, they're more dilated. So blood flows in a different way in people with who have a diagnosis of Fabry. The blood vessels themselves seem to be more irritable, I guess, in a sense. They're more reactive. So they're more likely to spasm and block off than the general population. The blood vessels themselves have thicker walls, and we get a lot of accumulation of lyso-Gb3 in the blood vessel walls as well. So that's a lot of the cause of stroke is probably related to changes in the blood vessels in the brain. There is also a link to the heart as well. If the heart's not beating completely in a regular manner, then little blood clots can be thrown up to the brain and cause a stroke as well. So there is a link to what we call cardiac arrhythmia as well in stroke in Fabry. So I'm just going to skip over that slide for time. And does enzyme replacement therapy help in reducing the risk of stroke? For a long time we basically said, oh, we don't know, we're not sure. But I think data is starting to come out now, meta-analysis, big analysis of lots of different studies indicating that probably it does help. So that's encouraging, I think, for the Fabry population as well. So we know that it helps with the heart, we know that it helps with the kidney, and now there's evidence starting to come through suggesting that it also does reduce the risk of stroke as well. So in the last couple of minutes, I'm just going to quickly run through some of the neurocognitive changes that have been studied in people with Fabry disease. So there've been a handful of studies, not lots of studies. I know Dawn and Nadia have done some wonderful work in this area, so I'm aware of their work. But the two main, what we call domains of thinking that seem to be affected in Fabry are what we call thinking speed and executive function. Thinking speed's pretty self-explanatory, but executive function is really all about complex planning, how you can do multiple things in your mind at the same time and allow you to complete tasks. So the various studies have shown that there are some deficits in those areas in patients who have Fabry. This table just looks at the various different ways that we can look at the way people are, that we can measure the way people think. So this column on the left is the different types of tests. And what I guess I just want to draw your attention to is this number here is the percentage of people who did that test with Fabry who had a performance in the kind of lowest 10%. So in the Fabry cohort, there was about 20% of patients in the trail-making test performed in the lowest 10% of the general population. So that's sort of how to interpret that. So you can see there's a proportion of patients, of people who have Fabry who perform worse than the general population in some of these tests of thinking speed and executive function. There we go, I've even mentioned Dawn and Nadia there. So depression and anxiety are also prevalent in the Fabry population, and global quality of life and pain are probably the most closely linked contributors to why there is a little bit more anxiety and depression in the population of people with Fabry. And classical males are more frequently affected than other parts of the population. So lastly, it does seem that regular counselling may help these symptoms of depression and anxiety, and that's an encouraging piece of work, I think, that's been done. So in summary, the brain is affected in Fabry disease. We can see that when we do imaging studies. We know there's a risk of stroke, and we know there are neuropsychological and neurocognitive effects of being a patient with Fabry disease. Enzyme may help these things, but also standard therapies are important as well. So things like controlling your blood pressure, not smoking, watching your cholesterol, regular counselling, those sort of things. So thanks very much. Happy to take your questions. Just asking the question about in the brain, is it different how the enzyme or the enzyme replacement therapy gets into the brain, and does it have a different effect there? I think it's pretty clear that the enzyme replacement therapy itself doesn't get into the neurons of the brain. It flows through the blood that flows through the brain and does a good job of getting into the blood vessel walls there, but the enzyme itself doesn't get into the brain. Now whether that's enough in a sense, I guess we don't know, because I think a lot of the changes that we see in the imaging studies are due to blood flow changes and blood vessel changes, not necessarily related directly to neuron changes. I don't think we understand what's happening within the neurons of the brain very well. So it may be that most of the effect of enzyme replacement therapy just needs to be in those blood vessels and the blood flow going through the brain. I think that's an open question.